Thank you for that introduction. Fantastic. Okay. So thank you for that introduction. So when I was given this brief, this title of this talk, I thought the best place to start again would be to bring everybody up to speed about where I was 10 years ago. So this is me. This is what 10 years in academia will do to you. So I was 8 years into my research career at the time. I was a research associate. I was a statistician working in the Centre for Trials Research. So the CTR, Centre for Trials Research, was only about 2 months old at that time, founded in August 2015. And the areas that I primarily worked in were around infections, antimicrobial stewardship, intellectual disability. And that might sound like I had it all figured out. I had my strategic areas, I had my path, but ultimately, I was interested in everything. I'm still interested in everything, but I would take on anything and everything that came my way. And there wasn't really any strategy with what I was doing, as I was told regularly by my line managers and by my mentors. I was also doing a PhD as a staff candidate, and what this meant was that I was compressing my full-time work into 4 days and taking 1 day a week to sort of carve out my own niche area, so medication adherence methodology. And this came off the back of 2 unsuccessful NIHR doctoral fellowships, another fellowship pathway that just didn't pan out. So this was unfunded, part-time, kind of as and when I could really do it. And my aspirations at the time were to progress in academia, maybe become a professor of clinical trials, maybe to become a head of an infrastructure group. So thinking back to that, really, when I was putting together this talk, I thought, well, what would be the sort of key advice I give myself back then? So I'm going to give you 4 pieces of advice I came up to. I could have given more, but these are the sort of key ones that really stuck in my head. The first one is find your why. So really sort of find what motivates, what inspires you, what sort of really sort of lights the fire in you to do the work that you do. And I'm a non-clinical, non-practitioner academic, so the research that I do doesn't translate into anything I sort of do to a person or to a patient. So for me, I thought, well, the motivator isn't as apparent as it might be to somebody who was a practitioner. But people is my motivator. And it didn't really take me long to sort of search and sort of figure out why that would be. So when I say people, I mean the people who are involved in research. I'm very fortunate to be someone who gets involved in global health research. And I do work in infectious diseases, and infectious diseases disproportionately affect people in low and middle-income countries. So the work that I do in that space has real potential for big benefits, and that's a real motivator for me. I'm also someone who's got personal experience of family members going through sort of serious illness, cancer, death, both as a child losing a parent, but also as an adult as well. So these experiences I bring into my work, and they really sort of drive a lot of what I do and a lot of the why behind what I do, sort of really wanting to make good on the research that I do, to benefit people who I've witnessed sort of go through these things. I sort of work a lot around bloodborne viruses, and these affect a lot of marginalized groups, people who don't want or can't take part in research, sometimes referred to as underserved, seldom heard, hard to reach. But really sort of underlying a lot of that, I find, is sort of internalized stigma, and I would view myself as someone who's an advocate for making sure that their research reaches these groups as well. And sometimes people do want to engage in these types of research and can't for structural reasons. So this photo up here is one that I took at a conference in 2022 in Canada, when this was a panel discussion to discuss HIV-related stigma in healthcare settings. And all you see are empty seats, and someone stood at a podium. So those empty seats were meant to be panelists, none of whom could get visa entry into the country to talk about this really important topic. So their voices weren't heard at the time. And then future generations. So these are my 2 daughters. Whenever I think about sort of research benefiting people in the future, I always think about them. I think that I recognize that the research I do today, as we've heard already, is going to benefit people of tomorrow as well. Second piece of advice, learn to lose well. If you work in academia, you're going to lose. You are going to be rejected. I'm stood on stage. I would describe myself as a loser. I'm sure there are people in the audience who might also think of themselves in the same way. That could be for papers, that could be for grant applications, that could be for conference abstracts, internal or external committees. The first paper that I wrote as a first author, I submitted, I got rejected, I got loads of feedback, I never went back to it, never got published. Really knocks your confidence, it really makes you question yourself, your worth, and your value. And I think the piece of advice I'd give myself back then is take some learning from it. Take some learning from the process that you've gone through, the experience you've gained to put yourself out there, because you are going to have to put yourself out there. Take the experience from the feedback you get as well, and learn to sort of move forward regardless of that. I debated long and hard with myself whether I'd put this photo in, but this is a really good example of me taking a loss. So I'm a really keen runner, and about 2 years ago, I took part in the Snowdonia Trail Marathon, and I pulled out at 20 miles because I thought I was experiencing a heart attack. I wasn't. I got checked over. I was fine. I got back into running. And then last year I decided that I'd sort of try and put myself through that again. Not the heart attack, but the race itself. And I did. So January came around. I stopped drinking. I trained a lot, and got to the race in July, only to get to the same point and get told, the race is cancelled, we're evacuating people from the mountain, it's 32 degrees, people are literally dropping left, right, and center, the race is over. I was gutted, you can see from this photo. And I thought this would be something useful to share here. This is all about sharing vulnerability, right? But the lesson here, I think, is that you can do everything in your power and in your control to kind of influence an outcome. But sometimes that's kind of taken out of your hands. The outcome's taken out of your hands. And I think this is a really important lesson to accept that that is a possibility and to be at peace with that to sort of effectively move forward. Process over outcome. We've already heard about the journey. This is one of my favorite quotes from Zen and the Art of Motorcycle Maintenance. The only Zen you find on tops of mountains is the Zen you bring there. And I think what this really says to me is we spend 99.9% of our lives going through the process of getting to the place we're wanting to get. So we need to start to learn to enjoy that. I think that if I were to give myself advice 10 years ago, this would be one of the really key things. I think I'm a striver, I'm still a striver now, but I was very outcome focused. What's the next thing? As soon as I'd sort of reach the goal, right, what's the next goal? What's the next goal? I'm not really kind of mindful of whether I was even enjoying the sort of parts in the middle. But that's where the life is. And all of these things are milestones, full summits, commas rather than full stops. And I think that that's a really important piece of advice that I would give myself. This photo, people might recognize where this is. This is the top of Mount Snowdon. So the day after the last one, I got some good advice, and I dusted myself off, and I sort of did get up to the top and back down again to kind of effectively finish this and put it behind me. I think that's all I need to say there. But process over outcome, the journey rather than necessarily the destination. Because I think we never really arrive. So I don't know if people feel that it's important to kind of get to that point, but these are just kind of points along the way. And the final thing, I'm sticking to time. I've only seen the 5 minutes, not the 1 minute. I'm going to get a 1 minute sign now. Oh, okay, there we go, 1 minute. The final thing I'll say is, to end on a positive, choose the people you want to work with. I've had the privilege of working with some excellent people. I'm flashing up some of those people here, even though some of the photos of me are less than pretty. Academia is hard, and I think that we work with lots of people, and I think that we will sort of enrich ourselves if we get to choose the people we work with and get to choose to work with good people as well. So people who want to collaborate, people who will challenge you, but also be happy to be challenged, because you're all working towards the same goal, even if you don't necessarily have the same kind of sort of, I guess, ambitions or values or anything like that. But you are willing to work in partnership and wanting to get the best out of each other as well. So this is a note I'll end on. Lots of people here. There's lots of other photos I could bring up here. There's photos that I have that I would not choose to bring up here as well. So now I'm being told to stop. This is me. Thank you very much.